Hello. Welcome to our postpartum talk. Give me 1 second to finish setting up. If you have questions, type them in the chat. So hopefully I will see them. Today we are talking about postpartum technology. Still working on this. Okay, random things in the background. All right. So, one more thing. Sorry, almost there. Almost got all the technology on board. Okay. The heck. Sorry, guys. Okay. Okay. Postpartum. So yeah, if you have any questions, type them in the chat, and I will try to answer them. So hopefully you know me. You're here on my channel. But I'm Dr. Carrie Dominic. I'm a pelvic floor physical therapist, and so we've been doing these talks about each trimester of pregnancy, and today we're talking about the 4th trimester, which is postpartum. And in my practice, this is probably like, out of my patient population, this is the highest percentage of my patient population, because going through pregnancy just changes your body. It doesn't matter how the baby comes out. Just does a lot to your pelvic floor. And so today we'll be talking about, kind of the things that we work on in pelvic floor therapy, reasons to seek out pelvic floor therapy. So what I want to start with is, I wish everyone got referred to this, but in the US that doesn't happen. So here you are learning about it on your own, so good for you. In other countries, they get this automatically. We all know there's lots of problems in our healthcare system. So another thing I want to talk about is in our society in the US, you get a 6-week postpartum checkup, and that is supposed to be like, you're cleared for exercise, for sex, for like life can go on. But really, that should be like the beginning of your healing. Like, you went through like phase 1 of healing. So it doesn't mean at 6 weeks, like, everything's back to normal. Things should be getting back to normal, but they're not fully back to normal. So I tell people, like, around 6 to 8 weeks, like, you shouldn't be leaking anymore. You should have bladder control. You shouldn't really have pelvic pain. Your abs, if they separated, which they probably did during pregnancy, they should be healing. You can go back to exercise, but that doesn't mean like you should go back to like exactly what you were doing pre-pregnancy or pre-delivery. There should be a process, and we just don't get this guidance in our society or in our healthcare system. So pelvic floor therapy is like why you should come and get guidance on these things. But yeah, so again, if you have any specific questions, let me know. So some people, let me just address the questions people like submitted beforehand. So hormones, they are still in effect in postpartum, and they have an effect on our pelvic floor. So if you're breastfeeding or pumping, your estrogen is going to be lower, and our pelvic, our vulva tissues, technically they're called like the outer labia, the outer tissues, not the inside of the vagina, but the outside. Those tissues have estrogen receptors in them. And so if your estrogen is lower because you're feeding, then those tissues are often thinner, drier. And so that affects a lot of the things that I see with my clients. So if you're having painful sex, usually the doctor's like, use lube, which, yes, use lube. But sometimes, like, those, you might have scar tissue if you had a vaginal delivery. But even if you have a C-section, like, some of my patients have pelvic pain or muscle tightness. And so, yes to lube, but there might be more to it than that. Um, and then also for some of my patients that have incontinence or bladder leakage, um, if those tissues are really thin, there's just not that extra layer of protection to help support the bladder. So it's a factor. It just is. It's going to be for a time. It's going to change whenever you stop breastfeeding, or for some of my patients that are breastfeeding for more than a year, after about a year, it's probably going to go back to normal. It's sort of in that early phase if you're exclusively breastfeeding, but sort of as your milk supply is lower, you're not feeding as often, those hormones are going to change, and so that thickness will come back. For a few of my patients that really have issues with that, you can ask your doctor for an estrogen cream. It's local. It helps those tissues. Yeah, so that's another solution. So hormones, so they're affecting it, and during pregnancy, the hormones are making all your joints loose so that your pelvis can open for the baby to come through. And then it takes a while for that to go back. It's not like you delivered the baby and everything's back to normal, right? It's a process, and then there's all the fun postpartum hormonal things, but that does affect your body and your pelvic floor and healing. Sorry, I'm clearing my throat a lot. It's been a long day and lots of talking. And then pelvic floor rehab. So, yeah, like I said, the common things people come to me for are diastasis recti, which is like abdominal separation. Let me show you a picture of this. I grabbed the wrong picture. Shoot. So this is a normal looking abdomen, but if this is separated, and so it'll feel like when I put my fingers in there, there's like a dip in a space or a hole. That is diastasis recti. It's normal. When you're pregnant, these abdominal muscles have to stretch to make room for the baby. And so again, I tell people like around 6 to 8 weeks, that should be mostly back to normal. Nothing's going to be 100%, but it's also considered normal if you always have like a one finger separation between your muscles. After a pregnancy, that's normal to have. So whether you have a diastasis recti or not, your muscles got stretched out. They're not going to be as strong postpartum. So you need to like rebuild the core and the core strength and do it slowly. So again, not going just right back into what you were doing. That's when I see people get injured. If they just went like right back to it, or they want to lose the baby weight, and so they're running or doing HIIT exercise, and they're having a lot of leakage or pelvic heaviness or pelvic pain, and it's just a little too much too soon. So, I think postpartum we really need to build strength back. So core strength, glutes, a lot of hip strength, like all these things. We need to rebuild our foundation before we're running and jumping and doing impact. So it's much more than kegels. So yes, kegels probably postpartum, again, especially a vaginal delivery, but even a C-section, like things are going to be stretched out, they're going to be weaker. It should be going back to normal around 6 to 8 weeks, but that doesn't mean 100%. So that's sort of my guideline for people. Like, if things aren't kind of back to baseline by 2 months postpartum, that's a good time to seek more help. Some patients of mine come in super early. I tell them they can come in as soon as the bleeding is stopped, to learn what kind of exercise is safe to do if they want a pelvic exam. If they just know like, oh, something happened in birth, like I need to get started on this right away. Like some people come in 3 or 4 weeks postpartum. And some people come in a year postpartum because the first year is hard. So there's no like perfect time to come. It's like what works for you. And that's different for everyone. And it depends on how your pregnancy went, how your postpartum went, how your delivery went, what your goals are, what kind of support you have, what you want to get back to. There's just a lot of factors. And so yeah, so if you want to get back to exercise, I tell people like really got to build your strength back, um, and beyond Kegels. So Kegels probably yes, but that's not the only thing. So a lot of my patients, uh, I tell people, like, let's say you have incontinence that's not going away. Yes, try Kegels, and hopefully that helps. And if that doesn't, that's when come see me or someone like me, because it's probably more than that. And yeah, all my patients, I'm looking. Yes, we're assessing pelvic floor, we're assessing abs, but we're also assessing their hip and glute muscles to see like, do other muscles need to be stronger? So, especially for my patients who want to go back to running or impact activity and they're having leakage, um, if our big muscles, our big thigh muscles and glute muscles aren't absorbing that impact, and we're expecting the little tiny pelvic floor muscles to absorb all the impact, it's just not, not it's not going to happen. Our pelvic floor muscles are small; they're not huge muscles, so they're not meant to absorb all the impact. So, um, for some people that they're leaking with activity, that's what I tell them. Like, we got to look beyond the pelvic floor. Um, and uh, Kegels. So let's talk about Kegels. So most people postpartum could probably benefit from Kegels. The one group of people that I tell, like, I can say almost across the board not to do Kegels is if you have pelvic pain. If you have painful sex, if you have pelvic pain, um, maybe even like hip pain, uh, probably have tight pelvic floor muscles. So in that scenario, we don't want to make a tight muscle even tighter by strengthening it. You probably need to do stretching. You probably need some direct pelvic floor work. So if you have pelvic pain, no Kegels for you. Um, but otherwise, if you have leakage, if you have heaviness, like try Kegels. If you just feel like you need to get strength back, like try doing Kegels. Um, but yeah, like try them. If that's not enough, that's the time to seek help. And my Instagram reel and short video that I posted today was about Kegels on the toilet, because I did a talk earlier today to a group of moms. And so, what is a Kegel? A Kegel is squeezing the pelvic floor muscles. And so sometimes we think about that when we're on the toilet, right? Like a good test for it is, can you stop your urine stream? But I tell people, so it's okay to test for it once in a while, like try to stop your urine stream. But don't do that every time you go to the bathroom, because then you're gonna confuse the signal, and if potentially, like, you might not be able to just like empty your bladder completely. So test it, but don't do it on the toilet. And if that's the only place you think about doing Kegels, go pee, go poop, and then do some Kegels afterwards. So that's my one advice about Kegels. But yeah, a lot of what I do is beyond the pelvic floor. So yes, we're assessing pelvic floor, but a lot of what I do is beyond. Um, yeah, and like I said, for my patients that want to get back to running and jumping, you know, are your other muscles strong enough to support you? How's your landing technique when you run and jump? Are you able to absorb the impact without the pelvic floor doing all of it? Um, if you pee when you like sneeze or cough, it's a pressure issue. So my one piece of advice is that let your sneeze out. It's weird in this time of COVID and all these flus and RSV and all these things, but wear your mask or sneeze into your sleeve, cover your mouth, but let your sneeze out, because if we're trying to like sneeze quietly, um, we're closing off this end, and it's just pressure straight down on the pelvic floor. So that's one thing with that. But yeah, if you're sick and you're coughing a lot, that cough is also a lot of pressure on the pelvic floor. So sometimes that can make symptoms worse. So the best thing to do is try to get rid of your cough, but I know sometimes there's these lingering coughs. But yeah, we probably have to strengthen the pelvic floor too. Uh, and the other scenario of leakage is on the way to the bathroom. You feel like you can't make it to the bathroom. So probably in that scenario, you need to pay attention and try to go a little more frequently. Like maybe you're waiting too long, or maybe you're drinking all at once. And again, in a perfect world, you would do these things perfectly, but in postpartum, especially early postpartum, these things are hard and it's not ideal. And sometimes it's like, oh, I haven't drank water today, so I'm gonna chug a bunch, and then all of a sudden I have to pee a lot, and then I'm stuck holding my baby while they're feeding. So yeah, sometimes just you got to just do the best you can. Um, yeah, and what else can we talk about? So another common thing, don't Google this if you don't have it, is called prolapse. So prolapse is like your organs in the pelvis are a little lower than what were. Um, and often that comes from like a long labor or baby was stuck in the birth canal for a while or who knows. Um, and so often that feels like pressure. For some more severe cases, it feels like things are falling out. If you don't know what this is, you don't have it and don't Google it, is my advice. But in that case, sometimes kegels, but sometimes there is actually tightness in the pelvic floor that we need to work on to kind of create more space for the organs in their position that they're in. But a lot of people can get rid of their prolapse symptoms with pelvic floor therapy and without needing surgery. So if your doctor tells you that you need surgery, that's the only option. Like, get another opinion. There's a lot of things we can do for prolapse before surgery. Um, yeah, and um, I think that's it as far as like generally what we do. So let me show you my pelvic model. Hold on. So in a pelvic floor exam appointment for postpartum, so I tell people like, if you want, if you're concerned, we will look at your stomach first and we'll assess for like the diastasis recti or separation. And again, surgery should not be your first option here. You should, most people can rehab this without needing surgery. Some people need surgery, but also I've seen people be super athletic and always have a little bit of separation or maybe a bigger separation. Uh, so always check that. We'll check for if there is a separation, how thick is it, how wide, how deep, is there anything going on, and we'll sort of build on that. And then this is my pelvic model. So a pelvic floor exam is kind of like going to your OBGYN. So these are the pelvic floor muscles. So I always tell people I'm still a physical therapist. I'm working on muscles. And they surround the vagina, they surround the rectum. There's individual muscles, but they basically work as a group. And if we look at this from the inside, it's like a big round muscle. So they're called the pelvic floor muscles because they make up the floor of the pelvis. There's really no bones, right? There's 6 bones. And these are representing all the organs that I took out. And so, yeah, basically just these muscles are supporting all your organs and all your inside. And so when you come in, if people are open to it, we'll do an internal pelvic floor exam. So I'm feeling the muscles internally. And the muscles are about 1 or 2 knuckles deep. So it's not that deep. So generally when you go to the OBGYN, they're bypassing all of this. And so I'm feeling for is there tightness, is there tension, is there tenderness, and then how strong are your kegels? And my assessment of kegels is looking at a lot more things. So I'm looking at, can you do a kegel? Is it hard? Does the muscle turn on when we ask it to? Does it turn off when we ask it to? How long can you hold it? Can you do it repeatedly? So sometimes it's like, I can do kegels, but I can only do 1, and that's it. Or I can only hold it for 1 second. So sometimes it's like, we got to practice holding longer. We got to build up the endurance. And the pelvic floor muscles are really part of our core. So they don't work in isolation, but if they're weak, we need to train them in isolation to be part of the system again. But normally, once they start functioning again, they're just going to do their job. That's normally what they do, right? Like, for most of your life, you probably didn't ever think about these, right? Until there's a problem. Um, and so, uh, yeah, so in my perception, if you need to do Kegels, it should be for a time. You shouldn't have to do Kegels the rest of your life. Some people say Kegels are forever. I think we should be able to train these muscles, and then they should just do their job, and you shouldn't have to do Kegels forever. But for a time, yes, sometimes we need to isolate these, and we need to strengthen them, and we need to get them working again. Um, but eventually, you shouldn't have to do them forever. There's really no need. If you want to, great. Do they make your orgasms better? Maybe. I don't know. But I think there's a lot of people that advocate like you need to do Kegels forever to have better orgasms. So maybe that's true. I'm not sure, but uh, yeah. So I think I've rambled enough. If you guys have any questions, if you're on Instagram, feel free to DM me. Send for comments, in videos or send me an email. Um, yeah, and then I do want to tell you that if you're not local to me, but you're like, oh, I need some help, I have some online courses for postpartum. I didn't even talk about C-section today, but I see a lot of moms for C-section too. So I have an online course for C-section recovery. It'll teach you how to work on the scar. It'll teach you how to strengthen your abs again, and how to incorporate that into like a bigger exercise program. Um, how to get things moving safely. I have an online program for postpartum return to running. So it's not recommended to do running or impact activities till at least 12 weeks postpartum. So, kind of some quick checklist things to know if you're ready is like you shouldn't have any pelvic heaviness, any bladder leakage. You should be able to walk for 30 minutes. There's some other like simple tests, but like you should have a foundation, like I talked about earlier, a foundational strength back before you go and do impact. So again, that 6 week check off from your doctor is really the like you passed stage one of recovery, but for a lot of my moms, it takes a year and a half, 2 years to kind of get back to normal. Not to scare you, but to say this is the reality. And yeah, I have some moms who are like 6 weeks, 8 weeks postpartum, like they're going back to the gym and they're doing intense classes. And so yes, some people have a great recovery. They're doing intense workouts. So, I really tell people like you gotta listen to your body, you gotta tune out all the external messages, and your body will tell you if it's ready or not. But generally recommending uh, not doing impact until like 12 weeks postpartum. Um, Question: how do you feel about doing gentle yoga or arm workouts after giving birth? Yeah, absolutely. I think you can start doing gentle yoga, some gentle pelvic floor like Kegels right away, arm, upper body stuff. Yeah, I think if you feel ready to move, like you can start doing exercise, it is exercise, movement, early. Like, I, my general guidelines, 2 weeks should be pretty restful. The first 2 weeks postpartum should be restful. And then, yeah, start going for walks, start doing yoga, start doing some gentle like strength training if you want. So, yeah, you can absolutely start that early on. Um, yeah, and again, everyone's different in their recovery. Some people feel ready early, like I'm feeling good, I want to move, and some people just, again, it depends on how your birth and your recovery go. Um, but yeah, when you feel ready, like yoga, some gentle like mat exercise, is a good way to start. Yeah, starting to kind of just like feel your body again, feel movement. Things are going to be different, and this is something that I think is really hard, especially if you're used to being active and fit and athletic. It's postpartum is wild. It's not like an injury, right? That like, oh, I sprained my ankle, I gotta like lay off of it, I gotta modify, like because of the hormones, because of like I got a baby to take care of. Just it's different. So yeah, I think starting with some gentle yoga or movement, and just sort of reconnecting to your body and figuring out how to move again, how that feels, and progressing that, and like I said, if you really tune in, your body will tell you. And then also a lot of people just start with like 10 or 15 minutes. I think that's practical in early postpartum. Sometimes that's all you get, a break from the baby. Um, yeah, so it doesn't, again, it's gonna look different for a while, and I absolutely think if people can get back to what they were doing, no matter how intense, it just depends on your recovery. And so, yeah, if you need guidance, that's what pelvic floor therapy is for, or a postpartum therapist. Yeah, and like I said, I have some online courses. I'm trying to think what else is online. There's some exercise classes, but the other fun thing we've started doing is some virtual workouts. So they're 30 minutes. They're basically mat exercises. And I've had moms 6 weeks to 3 years postpartum, and I don't have a set schedule yet, but I'm trying to get a more set schedule of doing these. They're really great. You can start them as early as you feel like, or as late as you want. And I feel good doing them. My body feels better. So we're trying to add more of those, and have a more consistent schedule and offer like varied times. Some people need to do it while their kids are in school or daycare. Some people need to do it after work. So that's another option if you're not nearby. But I do encourage you, if you can, if you have these symptoms that are persisting, and you can, see a pelvic floor therapist in person, because there's a lot of things that you need to see and watch that, if you have mild symptoms, maybe kegels or maybe an online program is enough, or maybe just getting back into some gentle exercise is enough. But yeah, don't rush it. I think, and a lot of my moms that have gone through therapy with me are like, oh, if I have another baby, I'm gonna go slower next time. Um, and again, every pregnancy you have is going to be different. Every delivery you have is going to be different. Every recovery is different, and we 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 can control only what we can. We like to think we can control everything, but not everything is under our control. So that's part of the process of becoming a parent, because that's the lifelong lesson. Um, yeah. So, any other questions? Type them in the chat. Um, but yeah, reach out to me if you have any other questions. And yeah, thank you for joining me. And yeah, maybe see you in some virtual workouts or in my office if you need. And yeah. All right. Have a good night, everyone.